I will tell you two things before we finish. One thing is CV. Unfortunately, the people who make the CV is pathetic. CV, you are writing BPS 18. Just tell me one thing. Even out of Punjab, who will know what is BPS 18? Even in Pakistan, people will not know what is BPS 18. And you are writing CV for you, and this is you are presenting to international forum. This is very bad. Okay, number one. Number two, it I found in doctor's CV, reference will be furnished upon request. This is again a pathetic thing. This is not for doctors. Okay, this is for other professions. They do like this. For doctors, it's never like this because we always have our seniors as our reference and recommendations. So please put your names over there. Then CV should be in a way that a person in UK or a person in Nigeria sitting over there, like Ibrahim is evaluating you. Ibrahim knows that what you are telling. Okay, your CV should be your pen sketch. The person who is reading your CV should know what you are. Like you have to explain the hospital where you are working. Is it a tertiary care hospital? Is it a primary care hospital? What sort of cases you do? What sort of procedures you do? This is CV. What sort of like for example, if you are writing MCPS, FCPS, they don't know what is MCPS, what is FCPS. Okay, so you have to explain. FCPS is Fellow College of Anesthetists, as well Fellow College of Surgeons Pakistan. It's a 4 year specialized training program, or 5 years or whatever, and we are doing like this. We have rotations is this. So this is, again I repeat the word, CV should be a pen sketch. Okay, when you are writing your contact, you should write about your social media contact, like of whether it is WhatsApp or Facebook, because now they contact you through these things. Okay, this is even all of you should make your LinkedIn profile. LinkedIn profile will help you in searching for jobs. Okay, I got one of the job from LinkedIn, believe me. So now I can say that even, and they contacted me because I just had a LinkedIn profile and they contacted me. I get a consultant job in Saudi Arabia from there. So LinkedIn profile is very important. And all the steps, like the first five, 6 lines, first page should be your profile, that I am this, I did my graduation from this place, I have this much experience, and this is what I want. So you can make it anything. And the place where you are applying, you should just modify the words in your profile each time you are presenting to any other place. But the rest of the things, people, and write in this one chronological order. The last thing should be the top. The last thing should be at your top. I have seen people writing about matriculation and FSC. They don't need it. You should be writing it at the top, the last. So the latest qualification or latest thing, you should be on the top. And people write about their courses and everything very prominently. But I think that is, you can put it in CMEs. Okay, CMEs, and then you can put it everything. You write about your training program, you write about your internship, you write about your interest, you write about your hospitals where you work. Few words about that hospital, that I worked in this hospital, which was a tertiary care hospital, that much bedded and covering this specialty. Few words, okay. And even now, this is now the era. You can even put the Google Map, Google coordinates, so that if they want to search, they can search. Okay, so this is few words about CV. Few words about interview. Interview, when they take, I had recorded a session for it, but I will repeat it. When they ask, the first question they ask is introduce yourself. So you just have to introduce yourself in a way that, again, the same words, like which I told you for the profile, that I am this, I have done this, I have done this 4 years. Like if someone asks me, I will say I'm working as a consultant at a tertiary care hospital of Ministry of Defense. That is the biggest hospital of Ministry of Defense, and that is in the capital of Saudi Arabia, Riyadh. I am working as a consultant for last 3 years, and mainly we are rotated through all the. I don't have any specific subspecialty qualification, but I have some diplomas. So I'm working right now in this whatever I specialty I'm working. Okay, this is one point, and then you can tell that I graduated from there. I did my training over there. I have that much experience, and I am applying for your job for this reason. So this is, they want you to know why, what you are, and why. The second question will be why you want to come here. So you should have clear objectives, that if you want to come to Saudi Arabia, you can say that I want to work in a better environment. I want to excel for my future. Yes, of course, because the financial situation is not good in our country, so I want to earn in a better. This is also a reasonable explanation. And when you are interviewing, even in the Zoom, I heard someone losing the interview because the internet connection was not good. Come on. You should have two or three backup internet connections when you are going for an interview. Okay? You should be well dressed. You should be sitting on a comfortable chair, and you should be looking at the camera. This is very important, because now because eye to eye contact is very important. So if you are not looking at the camera, maybe you are looking having squint in your eyes. Person will not understand you. Okay? So look, the place should be good. And now not your children should be you should not have cries of your children. Okay, so this is not a professional way. So these are the, usually they will ask you what you are, express yourself what you are. And then yes. So, and then you have to explain why you want to come here. Then you tell about your specialty, and then maybe they can ask you some few academic questions. Even in the academic questions, don't try to tell answer like a exam. This is just you can say interview means they just want to understand whether you have the skill to handle the situation or not. They are not usually they are not asking for any speciality. They are not asking any academic question. They are asking practical, total practical thing, that I will do this. I will take high risk consent. I will manage this situation. I will talk to the family. I will explain them the situation. The way I'm just giving you an example. Don't try to answer in I will take history, I will do examination. No, not like that. I will evaluate the patient on the basis of history, examination, and relevant investigation, and my approach will be to pick it out this thing. They don't want you the details, my dear. It's not FCPS viva. It's not like any academic viva, even if they are asking you a scenario. Okay, so they just want uh, this one they just want you to explain in that way. Okay, so those few words about interview and CV. And anyone, please, you are all are welcome. I'm just a message away if you want any guidance about anything I have told, whether about interview, whether about CV. And again, because this just a second, please.